Common cold prevention. Hand hygiene and wearing face masks are two proven methods for cold prevention. Face masks prevent spread of droplets that contain viruses. Hands hygiene through decontamination with alcohol or washing with soap and water for about 20 seconds before decreases spread of viruses, particularly from children. Hand hygiene is more important before eating or touching nose, eyes, and mouth. Disinfection of surfaces is another way to prevent the spread of viruses. Some methods and supplements have been effective in clinical studies, but more research is needed. The roles of exercise and sufficient sleep in cold prevention have been studied. Most clinical trials have not reported positive effect of exercise, however persons with limited duration of sleep had been more prone to develop cold. Reduction in cold incidence by gargling water 3 times daily has been reported. But more research is needed to prove the efficacy of sufficient sleep and gargling. Echinacea may modestly reduce the incidence of upper respiratory tract infections, but it has no effect on cold treatment. American ginseng also may have preventive effect against respiratory infections. Probiotics such as Bifidobacterium lactis and Bifidobacterium bifidum probably decrease the risk of respiratory tract infections in healthy people. Combination of Lactoplantibacillus plantarum and Lactocaseabacillus paracasei reduced severity and incidence of common cold. In clinical studies, drinking fermented milk containing Lactobacillus paracasei for 3 months have had prophylactic activity against common cold. Some minerals and vitamins have been investigated for this purpose. Preventive effect of zinc against cold is conflicting. While some studies have reported ineffectiveness of oral zinc in children and adults, others have indicated that taking daily zinc sulfate for 5 months may reduce the risk of common cold in children. Beneficial effect of zinc gluconate lozenges for prevention of cold in children and adolescents have been reported. Intranasal zinc is not recommended due to some adverse effects. Consuming vitamin C possibly is not preventive, except for individuals with intensive physical activity. Vitamin E may be modestly effective for cold prevention in elderly living in long-term care facilities. However, taking daily high-dose vitamin E for long time is not recommended due to possible serious adverse effects. Vitamin D supplementation probably has no role in prevention. However, there is some weak evidences that it may help to prevent cold in children. Conjugated linoleic acid, CLA, supplement is not beneficial for prevention of cold. Common cold treatment. You don't need any treatment, unless the symptoms are moderate to severe. Analgesics such as ibuprofen or acetaminophen are useful for sore throat or other pains in the body. Antihistamine and decongestant combinations are effective for runny nose and nasal congestion. Decongestants alone are less effective. Remember not to use intranasal decongestants for more than 3 days. Antihistamines alone are slightly beneficial just within the first 48 hours after symptoms onset. Intranasal or inhaled cromolyn sodium improves cold symptoms and leads to faster relief of the symptoms. Intranasal ipratropium bromide improves runny nose but not nasal congestion. These were treatments with strong scientific evidences. Now we talk about uncertain treatments which require more scientific research. The efficacy of expectorants such as guaifenesin and other mucolytic medications are unknown. Dextromtorphan modestly reduces cough frequency, but codeine is not effective. Saline nasal sprays may alleviate nasal symptoms. Pelargonium cedoides extract has been helpful for alleviating cold symptoms, especially when consumed 3 times daily for 10 days. American ginseng extract also has alleviated the symptoms and reduced the duration of the illness. Most clinical studies have found that zinc lozenges may reduce the duration of common cold. Within 48 hours after symptoms onset, consuming zinc lozenges every 2 hours for a total daily dose of at least 75 mg may decrease the duration of illness for average of 3 days. Zinc sulfate preparations in the form of syrup or lozenges may be better tolerated than some tablet forms. Vitamin C causes 15% reduction in symptoms severity. It may also slightly shorten the duration of the illness. Honey has been effective for symptom management and reduction of cough severity and frequency in children and adults. Heated humidified air and intranasal glucocorticoids were ineffective in clinical studies. As mentioned before, codeine was not helpful for cough. Antibiotic therapy is not helpful, since the agent causing cold is virus, not bacteria. Even it may be harmful due to risk of adverse reactions. Antibiotics are useful only if the secondary bacterial infection is confirmed. Thank you for your attention.